Member for Hants West.
Thank you, Madam Speaker, for the opportunity again today to take just a few minutes to talk about a little bit of the ongoing projects and so on in my area. And I want to kind of follow along with the transportation theme while we're on it, because it's been pretty disheartening to learn, and the people are not happy that the Highway 101 project has no commitment to it, to continue it. Now, most people would know if they've traveled that area, Madam Speaker, that you get to St. Croix, actually get a little farther than that now, you get on to Garland's Crossing, and then there's a stretch of the old highway that's still there and through the Causeway and over to Falmouth. Now, Madam Speaker, we have to realize that it does cost a lot of money to build a stretch of this highway, and everybody's pretty cognizant of that. I have, I think, 7 structures, if I did my math right the other day, that have to be built before the road bid actually gets built, which is, we know, very costly, but at the same time, there doesn't appear to be any plan to move forward, and there was commitments made, or we thought were made, to have the 101 highway continued. It doesn't look like that's going to happen anytime in the near future, and in all likelihood, this government will be long gone, thankfully, when we'll be able to make commitments a couple of more years out, and then we'll get back to business as the good government prior to has done. And they are the ones who have done, because the government before that, the Liberal government, canned the highway as it was making its way through Mount Uniacke and held it up for years to come. And it wasn't until the Tories jumped back in power that we saw the 101 highway and other 100 series highways begin the twinning as it should be for the safety of those drivers, Madam Chair. So it's a bit disheartening. I hear about it on a regular basis as to the importance of having such a project done. But there's a lot of important projects, and again, people do understand the cost that's involved, but they would like to see something. They'd like to see a tender called for overpasses or the cement structures that must be done, and that takes years itself to get completed. A lot of work there before you actually ever get across the Causeway and see that probably twinned, and that's a number of years out. But if we don't get started, it'll be a long while before we're there, and even longer before we're there. So I don't want to dwell on that too much. I know that the minister is aware of the importance of this highway. I know that the minister is aware and he cares about the safety of drivers on this highway, and I would never take that away from him or any other member in this House. I know that they understand that clearly, and I know that they expect me and others to understand that dollars are hard to come by. But I would say, and I'll continue to pick on this before I leave it a little bit, is that a government makes cuts, even on my RIM money. I understand there's been money cut from my RIM budget this year, and I know that every member in this House understands the importance of RIM dollars in all of our areas. It gets the little stuff, or what we refer to as the little stuff, the holes patch, the grass cut, and all of those good projects that most people do call about and want done. Still safety in our areas, and I haven't seen the final numbers yet, but I'm hearing somewhere in the vicinity of $160,000 has been cut from that RIM budget, and I'll be looking a little closer to see if that's accurate or not. I also hear there's some new machinery coming in, but to Hants County, but it's going to East Hants, not West, and maybe the minister over there will be kind enough to lend it to us once in a while, that grader, when we that's the plan, he says. Is it? Well, I hope that's the plan, and I'm sure I would say this, I guess, in the same breath, is that we have very, very good staff out there. I do know the folks in West Hants are doing a great job, and I'm sure in East Hants and all over the province, our staff that look after our highways and so on are doing a fine job. And unfortunately, their hands are sometimes tied by way of what they can get done due to cost being prohibitive and running out of budget money. But you know, the Minister of Finance talked about a $440 odd or $50 million, not thousand, I wish, $1 million surplus, and people are wondering, well, if we got a surplus, how come my road's not getting paved, or at least the hole's getting patched? Good questions, and ones we've had no real answers or commitments to. But we're going to continue to work hard to hold the government's feet to the fire and trying to get funds, much needed funds, to get these projects done. It has to be done. People are complaining about their cars getting beat up. Cars cost a lot of money today, as we know. I know that I've had complaints come in and written ministers, this minister and other ministers in years past, about tires and rims being bent and so on and so forth. And I don't know if any of them were ever compensated or not. Maybe the odd one, but got one. The honourable member from East Hants says he got one over the years. I know it's very difficult, and again, it's president. Governments probably don't want to get into setting by way of buying tires for vehicles, and it's left to the insurance companies. Again, here we go with insurance companies and the rising cost of claims. So people have to eat that, unfortunately, and they're already, their discontent is high enough without getting into things like that. It just makes their day even worse, and extra costs that they can't afford. With higher fuel prices comes higher everything else, whether it's transportation costs of goods and services. We know with the price of gas going up, well, we've already seen it. Tim Hortons, great example. The price of coffee has gone up. I just forget what, but it's gone up considerably. And of course, they're blaming, well, fuel prices are up. You have to ask, where did that coffee come from? And, you know, did it cost more to get it here? Well, I guess maybe it did. I don't know. We're going to assume that it must have. But it's funny, though, it's like our gas. We still need to buy our gas, and we still need to buy our coffee. It seems I don't see any less lineups, people in the lineup going through. So it appears as though we're willing to eat certain things because we have to. And, you know, individual choice. I guess we'll do what we have to do. But anyway, Madam Speaker, I don't want to take a lot of time today. I want to touch on that. I want to touch on a few other things. I want to talk about my volunteers. We have a banquet this evening, which is our annual banquet. We recognize a number of volunteers in my community. I know all of you are all the members, and every community has the greatest of volunteers, and thank God for them, because there's an awful lot of time and effort get put forward, whether it's the hockey team or whatever it is, baseball, swimming, whatever it might be. And we need to make sure that we are always recognizing and that we're cognizant of the work that they're doing and of their efforts. And it's important for us all to be recognizing, and I look forward to seeing those individuals later this evening. Hopefully we'll get back in time for that, and congratulating them on the good work that they do. But we'll do it here for the record today, and in future recognize them more formally. Madam Speaker, I want to talk about my hospital, Hants Community Hospital, a little bit. I haven't had a chance to question the minister yet, but without getting into any detail and knowing that we are in the estimates, I want to stress the importance to the people that are listening. Perhaps they still can't read the caption of who's speaking, but I think that they would know if they're watching who each of the members are. But anyway, the importance of this hospital and the people that it serves. It doesn't just serve the people of Windsor, it serves the people of Windsor, West Hants, Hantsport, parts of Kings County, certainly parts of Hants East. There are people that come into that hospital and are serviced by it. And we hear a variety of different rumors. It's always ongoing. The rumors about the hospital is going to close, the Merge is going to close. I've had emails from a doctor who say Merge is going to close. I want to stress the importance of this government, and I know that they know it. I know budgets are always at the forefront. Dollars and cents seem to rule the world, unfortunately, Madam Speaker, but we have to get our priorities set and get them straight when it comes to looking after Nova Scotians. And for a government that says that they are their slogan was a better deal for today's families, there would be a lot of people that are arguing that now, nearly 2 years in, who would disagree with that statement. And they would be right, given some of the cuts that we've seen, given HST hikes and what that has meant for people. There are people out there that are hungry. I have people coming into my office. I had a student about 3 weeks, 4 weeks back who came into my office one afternoon, and he said, Chuck, I haven't eaten in 2 days. Could I get a meal before I go to school tonight? That's the reality of where we are today. That's not just being made up. That's real. And I'm sure that every member is experiencing these things. We have a homeless issue, not only in my area, but in this province and around the country. We're trying to figure out a way right now to set up a shelter so that we can house these people overnight, at least feed them if they need to be fed, give them a place to go, and try to instill in them some values probably not the right word, but some worth. Make them feel like they do mean something to society, and to be able to direct them, set up an organization, a flow chart, if you will, to direct them to the services that they need to help them. This is very real in all of our communities, and I don't know that we're fully cognizant of that. I think that there are people around that aren't, that maybe are not dealing with it. I know in my community, we held a meeting back a month or so ago now, and we're having another one next week, but we had this homeless shelter type meeting, and I had calls, and they said to me, well, there can't be that many people around. Is this really real? It would surprise you at the people who are not aware that this exists in your own communities. It's incredible. They thought, oh, there might be one or maybe two. There are a lot more than that. I see the Minister of Health shaking her head. I know she's aware because I'm sure the letters and the phone calls, and we all deal with it. It doesn't matter which end of the province we're at, whether we're in Halifax or we're in Windsor or we're in Pictou or wherever we are. This is a real problem that we have in this province. I don't know how we're going to correct it. I don't think it takes a lot of money to correct it. I think it takes an interest, some people, some volunteers, certainly staff in certain areas that are already in place, but there has to be a process for these people to survive. Seeing kids sleep under bridges at night, people not even know when they're driving over the bridge that they're actually under there sleeping. Amazing. People don't believe these stories until these kids come out. Not just kids, they're certainly adults as well. But a lot of people aren't aware and they don't know. Coach, forget the terminology, coach hoppers or whatever they are, they go from friends to friends to friends. Those people are homeless, those kids. People, what do you call it? Coach surfers, there you go, coach surfers, that's the right terminology. That's real. People don't understand, oh, just because my kid's staying over at a buddy's house tonight and tomorrow night he's somewhere else and he hasn't been home for 3 or 4 days, those kids are for the most part homeless. And we need to recognize this and we need to figure out a way to go forward. And I know that we're always talking about our needs, but there are some real needs and there are some perceived needs. And then there are priorities that we have to have straight. And I'm not sure that that government, I know that they have a lot of issues. They have a lot of people knocking on the door. Everybody's always wanting something. When you're in government, everybody thinks you can just write the check, and the Minister of Finance would agree sometimes it's just not that easy to write the check. But at the same time, I don't think that people fully understand the importance of how governments prioritize. And the issues of homelessness in this province, they have to be addressed, and they have to be addressed sooner rather than later. That does not necessarily mean that there has to be large amounts of money invested in it, but there needs to be a commitment from government to see it through. And Madam Speaker, we have to, we can't forget those people. They're real people. They're not just people that are less of value than anybody else, than you or I or anyone else in this House. We're all equal, regardless of what our means are. And we may not all see that, but in the end of the day, we all came in the same and we're all going out the same with nothing. We shouldn't forget that, and we shouldn't lose sight of that, the importance of that. And what happens in between is what means the most. We really need to think strongly about that and how we talk about it being a better deal for today's family. We're committed. Every government will stand and they'll say the same thing. We all want to do what's right for today's families and the people in the province. What does that mean? Sometimes we're not sure what that means. But we need to have a strong look at our priorities as people in government, as MLAs in general, about what direction we go and what we support and what we don't support and so on. So anyway, Madam Speaker, with that, I'm not sure how much time I've taken, but I know we're getting near the end, and I know that I'll have other opportunities to speak in this chamber throughout the course of going into supplies. So with that, I'll say thank you very much and take my seat.
The honourable member for Halifax Citadel, Sable Island.
Well, thank you, Madam Speaker. Madam Speaker, it's a pleasure to get up and say a few words about my constituency and about the things that matter most to my constituents. As with the previous speaker, Madam Speaker, as we know from the elections and from the various polls and from those of us who've gone canvassing in our neighborhoods and every event we attend, people talk about health care. That's at the top of their minds, and in various forums and various places, the same issues keep coming up. And since 2009, and certainly when we were in opposition, Madam Speaker, that too was a priority for us. We promised when we came into government that we would devote our attention to a number of core priorities, chief amongst which was health care. And I'm delighted to say, Madam Speaker, that we have tried our best. We have worked very hard. The Minister of Health and Wellness and the government in general has worked hard to keep that promise and those promises, and they have succeeded. And I want to say something, Madam Speaker, about the reaction that these initiatives have got in my community of Halifax Citadel, Sable Island. And as you know, Madam Speaker, our party has been influenced largely by the great tradition of Tommy Douglas and his pioneering role in building the foundation for our healthcare system here in Canada. He fought hard years ago, Madam Speaker, against all objections, against people who said you are never going to be able to do it. He faced tremendous odds, and in the end built this foundation that sets the framework for many of the policies that help guide us here today. And really the latest sort of iteration of the Tommy Douglas philosophy is better care sooner. In other words, not only do we have to provide better care, but we have to provide better care when we need it. to people who need it, and to present it in order of priority, and to present it in particular to those who are most in need. And I want to thank Mr. Speaker, Dr. John Ross, for the great work he has done in helping us to identify the issues and defining them, and the great team of people he had around him. And many of my constituents in Halifax, Citadel, Sable Island were involved in that consultation, Madam Speaker. And as you know, a great deal of the health care of this province is centered in my constituency, not exclusively in it, but certainly a large percentage of the health care is driven by facilities and people who are in Halifax, Citadel, Sable Island. I want to say something, Madam Speaker, about emergency room care. It was a great issue it has been a big issue in the last decade. Dr. Ross set out many of the issues that bedevil us. He looked at emergency room care right across the province, particularly in rural Nova Scotia, and came to the conclusion that we could do a better job. We could make better use of the people who are working in healthcare. We could make better use of the facilities there. And out of that has come a number of new initiatives that are aimed at improving patient flow, for example. With patient flow, it was it seemed fairly straightforward. And now looking back on it, it seems very simple, Madam Speaker, that a great number of people were coming to emergency rooms who didn't need emergency care, that they were coming to emergency rooms because they didn't have family doctors when they needed it, or they didn't have healthcare workers when they needed it. And so providing a better streaming of those patients, and making sure that those people who need who are concerned about their health will get care when they need it is fairly straightforward. And I must say that very simple things, Madam Speaker, like the 811 system. 811 seems so straightforward now that many of us who've had young children, for example, have always, worried, especially the first-time parents have said, my child has a fever, is throwing up, and we say, what do we do? And 811 provides a lifeline to those people who have basic questions. Those people might ordinarily take their child to the emergency room, but now they can talk to a healthcare professional, they can talk to paramedics, they can be referred to the healthcare professionals that they need, and that diverts people away from our emergency rooms. We have the 211 system, Madam Speaker, that has just recently been announced, and I must commend, I believe that falls within the Minister of Community Services area of responsibility. And 211 is something that has been established in other provinces, notably Ontario. And it was just something I remember when I was first elected. Shortly before I was first elected, Catherine Woodman, who happens to be a friend of mine, our children went to school together, said, this 211 system is so simple, because we were talking about establishing a navigator program in downtown Halifax. And she said, well, 211 is really the ultimate navigator system. All you have to do is call, whether you have a community services emergency or anything. It doesn't really even have to be an emergency. If you have to have a concern about getting a check, or getting your child into school, or finding mental health services. It's one of those things, Madam Speaker, and in a way, Mr. Justice Nunn had talked about that as well, that he had said that in many cases, we have the systems in place, we have the resources in place, but the system somehow didn't connect with those people who needed those services, or families didn't know how to connect with the services. And so 211 promises to address that issue, and 211 will also keep people out of the healthcare system, will give people the care and help them to find that care when they need it. And so I want to commend Catherine Woodman and the United Way and the Minister of Community Services for responding to that after several years of finding a solution. And Madam Speaker, we know that many communities in Nova Scotia have a shortage of healthcare professionals. And a long time ago, we decided that maybe we should make better use of our healthcare professionals. Maybe we should make it possible for doctors and surgeons and skilled professionals to do what they do best. Maybe we should have nurses and nurse practitioners and midwives extend their scope of practice to do also what they are good at and what they would love to do. Maybe we can have ambulance attendants, paramedics do a little bit more of the work that is being done in emergency rooms and being done by other healthcare professionals. And I'm happy to say, Madam Speaker, that we are making great progress on that. And people are getting the care that they need when they need it, and they're getting better health care sooner as a result of it. And I know in my constituency, Madam Speaker, it's just simple. I was speaking to a senior about that. I was talking to them about broadening the scope of practice for seniors, and they said, what a great idea. What a great idea that seniors can get their help, and not just seniors, but any family, but seniors in particular are concerned about being hospitalized and being institutionalized and taken far away from their communities because there was no other way to treat them. And here we have a policy that says, paramedics might be able to treat people closer to their home, that they can be in their communities where their loved ones are around them, where they feel secure, and they won't go to emergency where they might end up waiting for long periods of time, and they might not even get the care they need when they need it, just because people at emergency, rightly so, tend to deal with emergency issues on a triage basis. So here's a very simple solution, Madam Speaker, that has broadened the scope of practice for paramedics, but it has also helped seniors and others get the treatment they need when they need it and where they need it. And I'm delighted that we have moved forward on that initiative as well. And yes, Madam Speaker, and the next, I believe it has been introduced, but it certainly has been announced in the speech from the throne, that we are going to extend the scope of practice for pharmacists and pharmacy technicians. And here's something as well, Madam Speaker, and I believe it has its origins in the H1N1 crisis that we faced. And out of that experience came a new understanding of how we deal with emergencies like that. I recall during that period that people were, said for a pre-assessment at the forum, the Halifax Forum, and a decision was made whether they should go to the emergency rooms or not. And that too, a form of triage, helped us streamline the process of providing health care. And so too with pharmacists and pharmacy technicians. I'm looking forward to seeing the regulations on that, but it does make sense, Madam Speaker, the general principle does make sense, that we should allow people to broaden their scope of practice if they have the skills, if they meet the necessary regulations, so that we can free up others to also do the work that they are more capable of doing, that each person and each institution does what it's best suited to do. And in that way, we can provide better health care sooner and closer to home. Much the same thing applies, Madam Speaker, with the prehab clinics. So that people who come in for orthopedic surgery have all the information they need, and there are fewer cancellations, there's fewer uncertainty, there's less unrest. Much the same with diagnostic testing. So, Madam Speaker, I'm dwelling on this in large part to say that many of the things that we are doing are done that speed up the process, that make it healthcare more accessible, but does it at a lower cost. Now, I know that there's a great deal of criticism on the other side of it, saying, well, we're not doing it the way we used to do it in the past. Well, I see that as a compliment, Madam Speaker. The things that we were doing in the past were not working. And every government Every government has to review its policies and procedures to see if we are getting value for our money, if the people that we claim to be serving are in fact being served, that they're being served quickly, and they're being served well, and they're being served closer to home. And this set of policies does that, Madam Speaker, and I'm happy to be part of a government that is moving forward on that. I also want to say something, Madam Speaker, about early identification, prevention programs, and diagnosis. You know, we seem to spend a lot of time, Madam Speaker, talking about people who are being treated in hospital and who need treatment and who are waiting for treatment, and I agree with that. But, Madam Speaker, we also need to take steps to prevent people from getting into those situations. We need to identify treatments early. We need to diagnose people. We need to get them care when they need it, where they need it. And I want to say something, Madam Speaker, about some particular initiatives. The Tanning Bed Act. You know, here's a straightforward initiative that we introduced in the last sitting that essentially says that if you engage in high-risk behavior, and again, we're looking at evidence-based healthcare policy, Madam Speaker, the evidence suggests that those people who use tanning beds, particularly those who are under 19, are at a high risk for getting skin cancer. They're endangering their health, Madam Speaker, and those people 60 years from now will become a huge burden on themselves, they'll become a huge burden on their families, and they'll suffer a life of, you know, of unnecessary illness. And so I would certainly, I'm delighted that we are in fact taking this initiative that says we're going to deal with these issues now rather than deal with them 60 years down the road.
While we're still in government.
While we're still in government. And I was recently at announcements about prostate cancer and a whole range of initiatives. Anyway, my point is, Madam Speaker, on these two initiatives.
Sorry, time has elapsed. The honourable member for Dartmouth East for the remaining 3 minutes.
Thank you. Thank you, Madam Speaker. And I know there's 3 minutes left. Madam Speaker, I would have let the member for Halifax Citadel continue for those last 3 minutes, but that's all right. Yeah, unfortunately, I don't think the rules permit, which is unfortunate. I thought just in those 3 minutes I would just mention a couple of things. One, I wanted to recognize that the member who is now the Minister for Labour and Advanced Education, when she had the entire, or when that minister had the entire education portfolio, I had asked her a number of times about the Prince Andrew High School renovations, and I'm pleased to see those continuing to move on. I know there's a new minister now, but I want to recognize that it was that minister that did help ensure that that moved forward, and I appreciate that very much. And I know that in her own riding, Dartmouth High School is, you see the work going, it needs a lot more renovations than Prince Andrew did. And I hope that as we look at particularly the issue of high schools in those areas, that we continue to support the vitality and the numbers required to maintain those critical masses in those two particular schools. They have a long history, of course. The other thing that I hope that that we can be looking at, and perhaps in the fall we'll be able to come forward with a private members bill to incorporate a theatre group or a theatre society for Prince Andrew High School, understanding that it's not always a direct responsibility of the provincial government to fully fund all the needed equipment in some of these theatres. And Prince Andrew High School has a very, very, very good theatre, but at the moment the rental revenues, it's old, and the rental revenues don't actually go to the operations of that particular theatre space, which is a challenge. It's a financial challenge, and I know that over the years municipal councillors and businesses have been kind enough to contribute to things like new curtains and sound systems and lighting, but we're at the point where, of course, the seating needs replacing because the seats are moldy, and we were fortunate actually to have a donation from Empire Company of their old Empire Theatre seats, but in the end they couldn't, for a lot of reasons, couldn't be installed. So that is something I think that we'll hope to have the government support on won't be in this session, needless to say, but as they try and create their own society to be able to raise money and continue the operation of that theatre, which I know that that minister and other members would know is extremely important in the community. And actually, Madam Speaker, I think you've probably been there too. But with that, I'm out of time, and thank you very much for the time of the House.
Thank you. The motion is carried. Order, please. We'll be taking just a short recess just to help things get set up for Committee of the Whole. Thank you. Order, please. The Committee of the Whole House on Supply will now come to order. We will continue with debate on Resolution E11 with the Minister of Health, and I now recognize the Honourable Member for Bedford Birch Cove.
Thank you, Madam Chair. The Minister of Health will probably know what I'm going to talk about now, because we've talked about this a number of times. Back in March, the member for Halifax Clayton Park, who is the Liberal Party health critic, and I sent the Minister a letter in reference to Lyme disease. And I have a copy of that if the Minister would like to look at it now. Okay. And then that could possibly be tabled afterwards. We noted that in the past, only areas that have been identified as having established populations of Lyme disease-bearing black-legged ticks had been targeted for public information sessions. And in the letter, we asked if you would expand the Lyme disease public information campaign province-wide this year, because we know that Lyme disease bearing ticks don't stay within a prescribed area. There's no invisible fence keeping them in. They travel on birds, they travel on rodents, they travel on deer. And so we feel that it's important for people, not just in the areas where Lyme disease-bearing ticks are endemic, but outside those areas, actually know about Lyme disease, because a lot of people seem to think that they are protected by the fact that they don't live in an area where the disease has been tracked, and so they think it's not going to be a problem for them, but again, it can be anywhere. So I guess my first question is, we're asking you to expand the Lyme disease public information campaign province-wide this year. I should mention, we haven't had an answer back, so that's why I'm asking these questions.
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair, and I want to thank the honourable member for the question. Because it's a very important topic, Lyme disease is becoming, I think, more and more of a public concern. And certainly we have had in the past isolated or very localized, I guess I would say, not isolated. Bedford could hardly be characterized as isolated, or parts of Lunenburg County as well. But localized, we had identified established populations of black-legged ticks in localized areas. And the department, the former department of Health Promotion and Protection, where public health resided, is now in the Department of Health and Wellness. But in the past, we worked very closely with the Department of Natural Resources to have surveillance, to try to identify where these particular ticks are. And the member would probably know that last year we extended the localized areas to include areas in Pictou County. And it is true. I mean, you know, my dad, old forester, kind of laughed and said to me, you know, you're not going to be able to confine those, any critters that you have in your province are going to, they may be localized now, but that isn't going to be the case for long because of wildlife, birds, all of these kinds of things that travel. So we can, I think, indeed be more certain that although we know we have established black-legged ticks in certain areas, they tend to be more prevalent, we have to be vigilant wherever we are in our province in the summer. And I don't know if the honourable member heard the radio this morning, Information Morning, but they've had this very interesting series of interviews. And today, Lyme disease actually was one of the things that was discussed. And I was very pleased to hear the information that was provided in terms of how do you attempt to protect yourself from Lyme disease. And obviously the first thing you need to do is to try to make sure that you don't get ticks on you if that's possible. And that you check very carefully if you're out in the outdoors, particularly if you're in wilderness and wooded areas, but it doesn't have to be all that wild. You know, these ticks can be in the grasses and people's lawns, really. And so last year, I want to tell the member, Madam Chair, that last year, after we got word from Natural Resources and Dr. Maureen Bakey had made herself available to the media and had answered a lot of questions, and I had been briefed, I talked with my staff about the very thing that the member has raised, the need to do public information and to broaden the reach of our public information to residents of Nova Scotia and indeed visitors to Nova Scotia, so that we are more vigilant and we do our utmost to try to help people, educate people, so that they first of all protect themselves to the extent that they can, that they do the techniques around checking for ticks, and that they also understand what to look for in terms of if they are bitten by a tick. I had a very good friend actually who last summer in the Lunenburg area was in fact bitten by a tick and developed the red bullseye rash around the bite and knew right away. And she's a person who keeps herself pretty up to date and informed of what's going on, has a long history of working in the healthcare system, but has retired, but knew automatically, and went to see her physician and was prescribed the antibiotics, and everything went very well. And that's the other thing I really want Nova Scotians to know and to understand is that Lyme disease, untreated, can be very serious and very debilitating, and has been for some people. But it is very important that people understand that this disease, this illness is treatable. It's particularly, if you treat it when you identify that you've been bitten. But it can be treated at any stage as well when you're diagnosed. But obviously, like most diseases, it's better to get the treatment early. And so also, Madam Chair, I want members, and I want the honourable member to know how the system currently works in terms of the provision of services and public health. Everybody here will know that we have a chief medical officer in the province, Dr. Robert Strang, who is an excellent public health official and oversees the public health of the province and is empowered to do this through legislation. And under him work a number of medical health officers. And these officers of medical health work in each district health authority. So they're spread around the province in each district health authority. And they work very closely with Dr. Strang. They're part of a team. But they also work within that district health authority. They work with the public health nurses, and they work with the physicians. And they are very much involved with respect to the local conditions, which vary sometimes from district to district. So perhaps you would have, for example, we've had black-legged tick populations on the South Shore for some period of time. So I would anticipate, and I know that the officer of medical health there has been more engaged around the matter of Lyme disease and information sessions and the development and the distribution of information than perhaps the medical health officer in some other district health authority, perhaps to use the Valley as an example, where there hasn't been an established population of black-legged ticks. So that's pretty much how the public health system is organized around this issue in a very simplistic way. The other thing I want members to know and to understand is how closely public health works with the physicians in the province as a general population. There are bulletins that go out on a regular basis on a variety of issues to physicians, and they are distributed to every licensed physician with respect to protocols and advice around various illnesses and diseases and treatments. And Lyme disease is part of that rotation of information. And so as we get toward the months when people are spending more time outdoors and the weather is improving and what have you, we boost up our information going out to physicians, and we remind them of a variety of issues. And Lyme disease is definitely a part of that, focus. But the last point I will make is specifically with respect to a province-wide campaign. We are, so after the Pictou County surveillance demonstrated last year that black-legged ticks were in that area, and I spoke with staff and I said, next year I would like to see us beef up the public information that we do on Lyme disease in Nova Scotia. It's obvious that this is moving now beyond one or two localized sites. And given the mobility of people in the province, and given that people will, for example, go to more than one camping site around the province. They might be on Kejimkujik one weekend and on Melmerby Beach the next, or they might be up in Ingonish the next in the Highlands. You know, it's really important, I think, that we have a broader campaign, and so indeed that is being worked on in the department, and we will be making that available quite shortly, Madam Chair.
The honourable member for Bedford Birch Cove.
Thank you, Madam Chair, and through you to the Minister, thank you for moving on that particular issue. I was talking to Dr. Gaynor Watson-Creed, who had indicated to me that the plan had been to do something more along that line last year, but there were so many reports, etc., so much surveillance associated with the H1N1 crisis that they just didn't get to it last year. So I'm pleased to see that. One of the things that concerned me last year was when the new population in Pictou County around Melmerby Beach when it came out in August, I wasn't on vacation, and I didn't hear anything about it until September when I happened to go on the site. So my concern was, I think, a press release went out, so I am hoping to see that we would have more of a concerted effort to get that information out, because as the minister noted, we have tourists in town, and we would hate for somebody to go home with an infection and not knowing, how they contracted it or what it might be, and have them not seek treatment immediately because they don't know what a bullseye rash is, or they can't see it because it's under their hair. And so my concern would be that when a new population is identified, that there be more of a concerted effort to make sure that information gets out to the population. I'm wondering if the minister could speak to that.
The Honourable Minister of Health and Wellness.
Thank you very much, Phil. It's interesting, the Honourable, my parents live beyond the Pictou County line into the Antigonish County area, and I was actually in that area just shortly after we announced that the results of the surveillance in Pictou County. And I want to assure the honourable member there was a good deal of information available in Pictou County. It was well covered in the local newspapers. And I know that district health authorities have brochures and these things which they distribute to physicians' offices and family practice sites all around their district health authority as part of the notification. So this is definitely a part of what we do, and we will continue to, provide information. And again, it's important to know that much of this information is provided at the local level, at the district level, not out of the Department of Health and Wellness. Because we have quite a decentralized healthcare system, we sort of set the policy, we do the monitoring, the evaluation, and those kinds of things out of head office. But at the district level, it's really where a lot of the practical application of that work occurs. So to help people understand the issues, the public health officers are there to educate, to work with the healthcare community, to disseminate information, to provide, to do information sessions, and what have you. And that's a very effective way to get the word out. It's really working with local communities to inform them and to promote the tick management approaches wherever possible. And so we, this is the process we use. I should have indicated that we are updating for this year the brochure that we do on Lyme disease. We're updating it and revising it, actually. And a poster will be done as well. And we will look at other means of communication. We'll certainly look at spots perhaps on radio and maybe again in the local newspapers that will create a level of public awareness around this issue and help people protect themselves and be more aware of this issue. Thank you.
The Honourable Member for Bedford Birch Cove.
Thank you, Madam Chair. And I just want to let the minister know that if she wants to do those radio spots herself, I have no objection. I'm just wondering if any new areas have been identified as having substantial Lyme disease-bearing black-legged tick populations since Pictou County was added last year.
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. I don't think that there have been any new areas, but the Department of Natural Resources, actually, they do the monitoring, the surveillance, and I know that it was a particular area in Pictou County that there was confirmation of the black-legged ticks, and that was in the Milmerby Beach area. I do know that there are other areas in Pictou County that are being monitored, but the surveillance results have not indicated black-legged ticks in those areas. And I would assume that this is the same throughout other places in the province where they're doing monitoring. Right now in Nova Scotia, we have 4 confirmed areas of Nova Scotia, that area in Pictou County being the most recent, but also in the in Lunenburg County in the Blue Rocks, Heckman's Island, First Peninsula area, and of course Admiral's Cove in Bedford, and Gunning Cove in Shelburne. So those are the 4 areas where there's been confirmation. And additionally, apparently migrating birds can transport the black-legged ticks into an area. And and they may or they may not become established in those areas. So the process is one to really do surveillance that will allow you to confirm with some with some credibility and certainty that the population is an established population.
The Honourable Member for Bedford, Birch Cove.
Thank you, Madam Chair. Lyme disease, as the Minister knows, it can be quite debilitating for those who have it and don't get immediate treatment. And as you know, a recent news story revealed that false Lyme disease test results were recorded for 24 Canadians, including 13 Nova Scotians. These erroneous test results meant the disease was left untreated in some of the individuals affected. We'd like to know if you can provide the number of Lyme disease tests performed in the province last year, and if so, can you also indicate how many of those tests were negative?
The Honourable Minister for Health and Wellness.
Thank you very much. To the Honourable Member, Madam Chair, I don't have that level of detail with respect to the number of tests that have been done. Again, I should perhaps lay out for the members my understanding of how this works. What occurs is, for example, if I felt I had been bitten by a tick and I go to see my doctor, then there's a blood sample, I guess, would be sent, perhaps the tick itself, if it's still attached. This is sent off to a lab, a national laboratory in Winnipeg, where testing is done. And the tests, the 20-some tests, of which more than a dozen were here in Nova Scotia, were those kinds of tests that were sent off to the national lab for confirmation. However, I understand that there is testing that can be done here as well, but it's not the same test that is done in Winnipeg, and treatment can start immediately. They don't necessarily wait because it's a treatment with antibiotics, and so this will occur fairly rapidly. Of those folks whose tests were sent and the lab determined that it was negative, and now we know that they were positive. All of those individuals were contacted as soon as we knew. Their physicians were contacted, they were contacted, and they all have begun treatment, and I understand that that has gone very well. So because I'm not a doctor or scientist, I don't really know exactly what the problem was, why the results at the Winnipeg lab resulted in the way they did. I know that there's a lot of controversy and a lot of debate about the accuracy of tests. And I met with a physician in the province, actually, who talked to me about the need to explore other forms of testing than the ones that we currently have, that using the specimens that we do don't necessarily, and they give you, in his view, a much higher frequency of a negative outcome. They don't identify Lyme when in fact people will have had Lyme in his view. So it's, I know it's a complex topic. There's a great deal of debate in the scientific and medical community around this topic. I rely to a large extent on the expertise of Dr. Strang and Dr. Bakey, both who are very well respected in their fields and stay very current on the literature, on the practice, on the various debates, and are very concerned about the health of Nova Scotians and put those considerations at the forefront of their decision making. And I feel that I get very excellent advice from them in these matters. We will continue to do the best we can based on the information that we have to protect people in Nova Scotia when you have these communicable diseases. Madam Chair, I don't want to go off on a big discussion about the environment and climate change, but one of the things that does worry me, and I'm sure it worries many people, is the potential for an increase in communicable diseases that result from a change in our climate, and our climate becoming a place that is more conducive to disease-borne bacteria or viruses or whatever. And it's not rocket science, I guess, in some ways, to really imagine that we are going to see the occurrence of diseases that we would have in the past, confined to warmer climates and places, outside of certainly a cold Canadian ecosystem. But this is a result, I believe, of a number of things, a change in our climate, and of course we travel now so much more than we have in the past as a population, and that mobility then has a whole different set of implications for public health practices. And I suppose in some ways it's not a new thing. If you think about diseases, big public health epidemics in the past, diseases in the past, diseases that were brought home from foreign wars in other places, little varmints that were brought from one continent to another as a result of colonialism, really, in many respects. So, I mean, we probably will see, and we need to have, and that's why I think it's very important to have a strong public healthcare system, and we do have a very good public healthcare system that is staffed and populated by people with not only the expertise and, you know, in terms of their credentials, but they have a passion for public health and protecting the public interest.
The honourable member for Bedford Birch Cove.
Thank you, Madam Chair. So I'm assuming that when the letter's answered, we'll get the number of Lyme disease tests performed in the province last year and how many of those were negative. The other thing that the honourable member from Halifax, Clayton Park, and I requested that the department consider removing the requirement for exposure to an area where ticks are endemic as a criteria for doctors to report a case as Lyme disease to public health. Since ticks do not remain within the boundaries of identified tick endemic areas, they travel on birds, on rodents, on deer, and therefore can be almost anywhere in the province. So I would like to ask the minister to consider discussions with her medical officer, Chief Medical Officer, about removing that, because we think it sort of adds another I guess, burden that anyone who has Lyme disease is going to have to overcome to have that disease identified as in fact Lyme disease.
The Honourable Minister of Health and Wellness.
Thank you very much. That's certainly something that we will consider.
The Honourable Member for Bedford Birch Cove.
Thank you, Madam Chair. This next series of questions may seem a little odd because they actually refer to something that happened before the minister became Minister of Health, and really I'm just looking for some information. The Paul Martin government sent our province $5 million for cataract wait times in 2005. And I've been contacted by an ophthalmologist, you know, sort of casual conversation, and he was saying that the ophthalmologists aren't sure that actually went to cataract wait times. In Manitoba, it was a line item in their budget, so they know where it went, but they don't have confidence that it actually went to cataract wait times. You know, he said to me, look, if there was something that was more important, you know, it's not that we don't understand, we just want to know where it went. So I'm wondering, did that money in fact go to cataract wait times? Did it go somewhere else? I don't expect the minister to know the answer now, but I'm wondering if I can get that information.
The Honourable Minister of Health and Wellness.
Thank you very much. And I want to thank the honourable member for this question because I think it is a very, very important question, and it's a part of a bigger question and a bigger issue. The provinces and the federal government signed a wait times guarantee a number of years ago. I think it was in fact part of the health accord. And we came to agreement on 5 areas where wait times needed to be improved. And they were cataract, cardiac, radiation, MRI, and diagnostics. I think actually diagnostics is part of that. And the 5th one is orthopedic. Now, and money was allocated, transferred to provinces to assist meeting benchmarks. And an awful lot of work had to be done And work is actually still being done. And we get reports then relatively regularly on the wait times, on how we're doing. Nova Scotia has been able to meet our wait time benchmarks in cardiac and in radiation. But we have not been able to meet our benchmarks in a number of those other areas, particularly orthopedic and cataract. Now, and when the reports come out, health ministers lie on the floor and hyperventilate in Nova Scotia because we were at the bottom of the pile going in, and we still are. It's very, very difficult to overcome the long-standing handicap that we've had with respect to where we fall on the wait times. The Kai-High wait times report came out not so long ago. I probably have it here someplace. And I sat down and I read it very carefully. Because usually, to be honest, when it comes out, I get time to read the executive summary and the 4 pages of briefing notes, which is a summary that my staff prepare for me. This time I read it from cover to cover. And I'm really glad I did. Because what I began to see is that Nova Scotia is not the only province that doesn't meet the wait time guarantee. In fact, on orthopedics, for example, none of us are meeting the wait time guarantees. We've been unable to achieve that. And there are actually, and although we have probably the worst, we're the last in terms of meeting the targets. The spread isn't that far apart between us and the next worst, and actually the province that's doing the best. The spread is really quite narrow, although I concede we still are at the bottom of that heap. Now, cataracts is an interesting question, you know, in terms of its area on its own in that area. Cataract surgery, as the honourable member is a lot younger than I am, so maybe you don't remember this, but the cataract surgery is a lot different today than it was 40 years ago. I remember when I was a young child, my grandfather having cataract surgery, and it was a very big deal to have cataract surgery. A long procedure, a long recovery, and today, my mother had cataract surgery a few months ago, I think in January, and she was in and out in 15 minutes. It's a completely different animal than it was when people actually went under anesthetic and, you know, all of that kind of stuff. So, with respect to the $5 million that Nova Scotia received for cataract surgery, I can't categorically stand here today and say, yes, all $5 million went toward cataracts, but my gut instinct is to say that we probably spend more than that on. We probably have been spending more than the $5 million additional dollars to try to improve cataract surgery in Nova Scotia, and but we didn't track the wait times money in that way. The wait times money came to us in a chunk for all of those 5 things, and went into general revenue in the Department of Finance, and then came out of the Department of Finance to the Department of Health for our various budgetary requests, which would include physician payments, where the cataract money would be for the most part, because physicians perform this procedure in their offices or in a clinic in a hospital. But we are, as provinces, preparing for our next round of negotiations with the federal government with respect to 2014. And we are going back and unraveling, if you will, the paper trails of money, so that we can, in fact, have a very clear picture of where the money went. But I can assure the honourable member that monies transferred to this province to improve wait times in the healthcare system went into the healthcare system to improve wait times. There's no, and I think the radiation treatment would be an example of where every penny of federal money that we got went into radiation therapy and more. And we probably tripled that on a provincial level. So it's a challenge. It's a challenge both, bringing wait times down is a challenge, and demonstrating every nickel that you get and spend toward that amount. And healthcare is so complex, it's not a simple business enterprise, and there's no such thing as a simple business enterprise, but certainly the healthcare system isn't a simple business or financial enterprise. It's very, very complex. And it's always interesting, though. There's a fair amount of competition within the healthcare sector, I find, and you find sometimes that certain specialty kind of, they feel that maybe the monies that have been allocated to them aren't really coming to them. They've been, it looks like those guys over there are doing a little better. They're getting a little more operating time, and their wait lists seem to be a little better, and what have you. And, it's just natural, I think, in a system that's as big as our system. And, frankly, it's a system where these doctors and specialists, they want to be working to their full capacity. They want their patients to get the best quality care they can as quickly as possible. And, they want to hold the government and the bureaucracy behind the government accountable for how money is being spent. And so I understand that. I accept it. And if there is some way, when the information is available, then certainly I will make it available. Thank you.
The honourable member for Bedford Birch Cove.
I might also, thank you, Minister, and I might also suggest that maybe this next round, in the interest of transparency and openness, if we do get a chunk of money for a certain procedure, that in fact that be a line item in the budget as is done in Manitoba, because then everyone can see where it's going, and I think it might make it a little easier. We're trying to figure out afterwards, where did the money go? And I realized that the minister was not the minister when this money came to the province. So I'm certainly not quarreling with her answer, and I do appreciate her offer to give me that information. I'm just wondering, in terms of midwives, this was an area that I began hearing about not too long after I was first elected, because there was a couple in my riding who could not, despite registering immediately upon conception, if not sooner, to have a midwife could not get in, despite trying a number of different times to access that particular issue. And so I'm just wondering, in terms of the midwife program at the IWK, has there been any progress after that program just, I don't know, imploded or came to a halt, if there's been any progress on that file?
The Honourable Minister of Health and Wellness.
Thank you very much. Midwifery, as the honourable member and other members know, it's taken a long time to get to the point where government has, in fact, in 3 DHAs, piloted midwifery services, and that's in Scotia, Guysborough, Port Hawkesbury, Strait, Antigonish area, and on the South Shore, under the Deputy Minister, I add, who was the CEO there at the time, and here at the IWK. And really, it's not a very well-established program. It's still a very new program. The program at the IWK only started in the fall of 2010. And there were, as you know, difficulties, and the program was suspended, really. So the program, I should say, they were 09. It was only fully staffed by the fall, though. It started, they didn't have a full complement of midwives. They continued to recruit. They got a full complement, and then it sort of ran into its difficulties. As well, I think the other DHAs, I think Scotia had difficulty recruiting a second midwife, but they have a second midwife there now, and the members would be familiar with Scotia. Scotia is a very large geographic DHA, quite spread out. It's the kind of certainly the kind of geography where you would want to be able to provide midwifery services, to the whole district, and particularly to women who live in some of the more sparsely populated parts of the district. So the plan, I think, and the implementation of the midwifery program did not occur under this government. It was initiated by the previous government. It was a program that we certainly supported and believed very strongly in, believed that midwifery is an important piece of healthcare service. And so the program was initiated under the previous government. The entire program costs about $1 million, $1,041,165 to be precise. And it was always the intention to evaluate the program and to then extend the program into other DHAs based on, other DHAs being ready and on lessons learned, having lessons learned. The program has, without a doubt, seen some bumps, and the bumps in particular, there have been bumps at the IWK. There have been some difficulties at the program at the IWK, and I've met with various I've met with various points of view around that. People who work at the IWK in the maternal care team, and with midwives and with the Midwifery Coalition and with different groups to try to understand the various perspectives and hear their point of view, and to work at how we can get this, I think, important program on track for women who live in the Capital District Health Authority. And what we said was that we would do an independent review of midwifery services, not only at the IWK, but also in Scotia and on the South Shore. And we have recruited a team. We've just finalized the details of that team, who will do the review. And the team is of a mix of healthcare providers who have experience. We have a midwife from Ontario who is very well known, and she will lead the review team. We have a midwife as well from Manitoba, and we have a family doctor who will be involved in the review, as well as a manager of maternal care from Manitoba. The family doctor is a doctor from British Columbia. And it's interesting, I've met with many people. There's a wonderful doctor who many of you would have heard, I think, Madam Chair, on the radio, whose name is Dr. Heather Scott. And she was over at the IWK. She's gone off to the World Health Organization in Geneva right now to pursue research that she's doing on midwifery in the healthcare system. And she is a very, she brings a lot of expertise and balance to this issue. And as well as we had an internal group did a review in our primary and maternal care section of the department. And so we're getting good advice, and we are going to proceed in a way that will help us strengthen the two programs that we have on the South Shore and in Scotia, and that we get the capital midwifery program moving forward in the direction that we want it to go. And I have made that commitment to the various parties. I have essentially made it clear that until I feel confident in what it is we currently have in the 3 DHAs. I'm not prepared to expand this to the entire province. The point of having some pilot sites is to learn from those sites. And until we've completed that process, I think it would be not advisable to do an expansion. That's my view. But this government remains very committed to midwifery services. So we will take our time and work through this process. And I'm very much looking forward to the team who will be here doing the review and working with us.
The honourable member for Bedford Birch Cove.
I'm just wondering if the minister can indicate what the timeline is for that review, because of course women who are expecting babies or hoping to be expecting babies are on a very different timeline. They're on a 9-month timeline, and if they want to be involved in that program, it would be good to know when this might happen.
The Honourable Minister of Health and Wellness.
Thank you very much. I think our expectation is that we will have the report prepared by the end of June, and the leader of the review team will be here this month, and the full team will be in the province in mid-May. And then we're hoping that they'll be able to complete their work and get it to us by the end of June. And this will be very, very useful, and it will help. I think it will dovetail nicely with some other work we're doing in the department on primary care.
The Honourable Member for Bedford Birch Cove.
You mentioned that the budget number for this program is $1 million. I'm wondering if the money that was to go to the IWK is still going to the IWK, even though the program is suspended there.
The Honourable Minister of Health and Wellness.
Yes, absolutely. There's been no reduction in the amount of money allocated to the program, and as I understand it, the IWK have advertised the positions, and I haven't had a recent report on the status of the competition or those job openings. But certainly, we are looking forward to working with all of our DHAs who had midwifery programs, and as well continuing to work with the various stakeholders that have worked so hard to get us to the point where we had midwifery programs. And I want to reassure them that they will continue to have a role in this process as we move forward.
The Honourable Member for Bedford Birch Cove.
One of the issues when I had the couple in my riding who weren't able to get a midwife, they were told various things at different times about why they weren't being they weren't in the intake stream, I guess, for that particular program. But one of them was around the whole issue of when their baby was being born. They were told that their baby, I think, was due at the end of March, and they couldn't take them in because, well, they would have vacations then, and there would be too much overtime previously, so they weren't going to be taking in patients who were due to deliver during March at the end of the fiscal year. And so I guess I want to bring that to the minister's attention, because I think I understand the need for budgetary concerns and everything, but on the other hand, a baby is due when a baby is due, and I'm not convinced it's any more expensive to send a person to a doctor to deliver. We're just moving numbers around. So I want to bring that to the minister's attention, and just wondering if she has any comment on that.
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. First of all, there is a bit of a fallacy, I guess I would say, a misconception. There is a misconception. There's a misconception that midwifery is a lower cost alternative to maternal care than other forms of maternal care. That isn't necessarily the case. I myself am more likely to be swayed by arguments, not economic arguments, around midwifery. We should have midwifery because it'll save us money. I'm more persuaded by arguments that tell us that midwifery will help us have healthier children, healthier babies, and healthier pregnancies, and particularly in lower risk situations. And for that reason, I think that is reason enough, that should be reason enough to pursue midwifery and have it as a piece of our healthcare system. We want healthy babies and healthy mothers who have successful, healthy pregnancies. And we want mothers to breastfeed, for example. And we want less surgical interventions and procedures. And so I know that many groups and organizations think they've got to make economic arguments to government because that's what moves government. That's what sways a minister, persuades a cabinet, persuades a government. And I kind of say on this one, don't come and talk to me about money. Come and talk to me about healthy kids and healthy mothers and better pregnancy, and you'll probably get a lot farther. Although I do recognize that, that there is a cost to doing these programs. But, you know, the other thing is it's just not the case that introducing midwifery into Nova Scotia saves money. It actually is an add-on to our healthcare system. So we, as a result of having midwifery, we don't have less beds in maternity hospitals. We still have the same amount and all of that kind of stuff. So it's not a you know, a straightforward kind of proposition. But the important point, for me at least, okay, the person who is standing in the shoes of the Minister of Health today, is what is good in terms of healthy babies and healthy mothers and getting higher rates of breastfeeding, less surgical interventions, and those kinds of things, which will result in better health. And the evidence has been there for a long time that, that midwifery is all of those things. And so I think that's really very important. The thing I struggle with, to be perfectly frank, around midwifery is how do we get midwifery services to those populations that need them most, rather than the member for Bedford Basin, for example. So, you know, I'll be perfectly frank. So rather than, it's the socioeconomic question. You know, how do we get midwives working with younger moms, perhaps, lower income, less formal education, and to bring good information about maternal health and care to those women so that they have better awareness about their diets, about alcohol and tobacco use during pregnancy, and not just during pregnancy, but beyond, breastfeeding, healthy birth weights. What are we going to do to ensure there's a healthy birth weight? And all of those kinds of things, you know, and it's interesting. I think a lot of the research does show that people who are more likely to use midwifery services are women who are better educated, they're higher socioeconomic status, and they might be the women who would do a lot of the practices that you want done anyway, breastfeeding, all of those kinds of things. So it's how do we really make this a program that is universal. It's going to be available to parents and women who are having children, but how do we make sure that women from more disadvantaged populations have access and make use of it in a way that will really make a difference in their maternal care. So that's a challenge, and that's something I think about and we struggle with, and we probably will continue because there isn't an easy answer to that. But again, I'm very excited about the team that's been put together. They're stellar. The composition of that team is exactly what the competition of such a review team needed to be, because they bring all of the perspectives, plus they bring a lot of experience, and they have the right balance in terms, you know, we have a couple of midwives, so they're not, I don't think they're in a situation where they would feel that they're marginalized in any way by other providers.
Thank you. The time allotted for the official opposition has expired. I now recognize the honourable member for Victoria the Lakes.
Thank you very much, Madam Chair. I'm certainly pleased to stand here this afternoon to ask the Minister a question that I know she is probably anticipating anyway. And I'm just going to be kind to her today and ask the one question, and we'll be turning it over to my colleagues. And Madam Chair, this time last year we were standing here during estimates talking about the Highland Manor in Neils Harbour. At that time, there was a great deal of concern expressed by the Fire Marshal's office as to whether or not the license for the manor would be renewed. And I must say that I want to thank the Minister and her deputy who visited the site last summer, and I had the pleasure of being there when he met with the administrator and board of Highland Manor. Most of those issues have been addressed, and again, I want to thank you for that. But one key thing in the Fire Marshal's report was the lack of space within the existing facility. During the meeting at that time, the deputy did say that nursing homes were being reviewed for expansion or construction. And I guess what I'd like to ask at this time is whether or not the Highland Manor in Neils Harbour is being considered for an expansion. I ask that because I know that the municipality of the County of Victoria has purchased an adjoining property to allow for that expansion to take place. So I'd like to hear what the Minister has to say.
The Honourable Minister for Health and Wellness.
Thank you very much, Madam Chair. And I knew when I saw the honourable member get to his feet exactly what he was going to ask me about. And I'm pleased to know that many, not all, but many of the issues that you know, were there this time last year have been resolved, and that's a very good thing to know. I'll tell you, this community certainly fights hard for its residents and for its seniors, and that's a good thing. So the manor is a 19-bed facility, and we have quite a number of small facilities like this around the province. The first phase of the continuing care strategy built new beds, and it replaced beds that no longer really met the standards. We have been going through a process in the Department of Health, and I don't know that it's completed yet, but we certainly have the process well underway to go out and look at you know, the remaining facilities around the province that are of a certain age, to get a better understanding of what future replacement facilities are required. And so at this stage, that work hasn't been completed, and I can't answer the member about whether or not Highland Manor will be expanded as a result. But what I can say to the honourable member is that we are looking at the other facilities that have you know, have space needs, and whose facilities no longer meet current standards. And when we get a better picture of the whole totality of what is required around the province, I will have a much better idea of what the where Highland Manor stands within that picture. You know, I'd be happy at that time, once I have the information, to sit down with the member and have a more fulsome discussion with them around it.
The honourable member for Victoria the Lakes.
Thank you, Madam Chair, and thank you, Minister, for your remarks. I guess I can't stress enough the importance of that facility in the North Smoky area. It's not just serving one community, and I think if geography is taken into consideration, the importance of an expansion of a facility of that sort in that area is very important. Our population is aging, and when you consider that the nearest home would be in Bedeck, which is at capacity now, I believe, the Highland Manor, a 19-bed facility today, could be easily a 40-bed facility and still have a waiting list just from residents of the area. So again, I can't stress enough, Madam Chair, the importance of serious consideration and hopefully in the not too distant future an announcement of an expansion of the Highland Manor in Neils Harbor. Thank you, Chair.
The Honourable Minister of Health and Wellness.
Thank you very much, Madam Chair. Well, just to provide a tiny bit more detail to the honourable member, the review that is taking place will review all nursing homes and residential care facilities that are older than 15 years. So Highland Manor will fall well within that, that parameter, that have not had a major renovation. And this information will be used for future planning for renovations or for expansions, replacement funds. And the assessment, I'm told, for Highland Manor hasn't yet occurred, but will be occurring sometime this spring. So you can let the administration there know, give them the heads up that they can expect a visit sometime this spring for an assessment. And then, as I say, we're doing this right across the province, and a report will be prepared and will hit my desk at some point, and then we'll see where it goes from there.
The Honourable Member for Hants West.
Thank you, Madam Chair, and glad to have the opportunity for a few minutes this afternoon to ask the Minister a few questions. I want to start on a positive note, certainly, with saying how pleased we all are, the administration, the staff, the residents, families, to have the Windsor Elms complete. The new village in Falmouth is a fabulous institution, well built, and serving the good people of the province well. Many people there. There was always a waiting list, I guess probably safe to say, Minister, but there's an incredibly long waiting list now because, as we all know, single rooms, new facility, everybody wants a piece of that. They all want to be at the Windsor Elms, which is a great thing. And I'm glad that we have that done, and I want to thank you for seeing that through. It wasn't easy, I know. There were many meetings with some difficulties and trying to work things out and to stay on budget, which is always key. So we're very happy to have that done, and the work that went into that on members of your staff and yourself as well. So I do want to talk a little bit about the pharmacare plan, the Fair Drug Act. Just some comments on that I've had, certainly from pharmacists. They're not jumping up and down, as I'm sure you can imagine. I'm not sure exactly. I know that there's a cost saving of $6 million that you referred to in there. I'd like to hear a little more detail on where are the real savings, I guess is what I'm thinking. Are they going to see it at the counter when they go to buy their drugs is what people are wondering. And that sounds like it's a good thing. Obviously, anytime you're saving money on the cost of drugs, we all know the cost of prescriptions and drug plans and so on, but even the price at the counter is very important. So what are we going to see at the counter. Why wouldn't this be beneficial to the pharmacists? Why are they not interested in seeing this? They want to see it delayed some, is what I'm hearing. They don't want this rushed through. There's obviously going to be a number of them come in through law amendments, I guess, to speak to this, and I'm not sure the downside. So there seems to be a bit of clarity here that I'm looking for, that I'm not 100% certain on why this, it all sounds good. So I'll leave to you just to enlighten me a little bit as to why there'd be issues with it, or it's actually as good as it all sounds.
The Honourable Minister of Health and Wellness.
Thank you very much, and I want to thank the honourable member. It's a very important topic. It's one that's very important to me and my government, and I know to all members here. Nova Scotians pay too much for generic drugs, period, full stop. We all think of generic drugs as being the, the cheaper knockoffs, right? You have the brand name drugs that former progressive Conservative Prime Minister gave patent protection to, for extended patent protection in Canada to the brand name drugs for 25 years, I think. And then, we as consumers all believe that when those patent protections expire and generic drugs become available, we're able to get drugs much more cheaply, except, guess what? We haven't gotten generic drugs more cheaply at all. We've been paying, anywhere, on average, around 63%, but higher than that in some cases, maybe 70% or more for some generic drugs. And it's just not right. That's not what we should be paying for generic drugs. The cost that the generic drug companies have to invest in generic drugs isn't anything like the cost that the brand name manufacturers have had to put into the research and development. And there's a lot of research that suggests that the reason why generic drug prices are so high is that, in fact, those prices are inflated to cover the costs of marketing the drug, just retailing the drug, just getting it into the hands of consumers. So we're paying through the nose for these drugs, and it's not fair. It's not right. And not only that, it's not sustainable. The amount of money that we spend on drugs annually in the province of Nova Scotia has climbed exponentially, much faster than the growth in revenue to support our drug programs. Our pharmacare programs today are $258.6 million. And I think they are the fourth largest item in the healthcare budget after salaries for doctors, the physician payments, long-term care, and acute care, the DHAs. So really, and it is the drug part of the Department of Health that's growing the most rapidly. Other areas are growing rapidly, but it's drugs that's growing the most rapidly. And so if we're going to keep our pharmacare programs affordable, then we need to look at ways to get better deals for taxpayers and for beneficiaries. So, oh yes, okay. So you had a number of questions in your opening comments, and you talked about at the counter. Will the consumer at the counter see a reduction in their costs. You understand, government, we've said that we anticipate a $6 million reduction in the amount of money we spend on drugs as a result of our Fair Drug Plan. So what about consumers at the counter? We anticipate that members of our drug plans will see a reduction of $1.6 million at the counter as a result of the drug plan. And how does that work? Well, that works this way. When a senior goes to get a prescription, they pay a copay at the counter up to $300 and some odd. And that's right. And depending on what drug they're on, their copays, well, you know, they will be able to get a better deal. And people who are in the Family Pharmacare program, although it works a little differently, they have to, before they get the benefit of the program, they have to spend so much on drugs. They too will get, they will realize some savings. We had, I don't have it with me right now, perhaps I can get it and table it for tomorrow. We had a couple of examples when we announced the Fair Drug Plan. One for a senior in the Pharmacare program getting a certain drug that per prescription they would save so much, and over a year we anticipated they could save about $300. And the same thing for a family getting a particular drug. They could save more than $300. So this is money back in the pockets of Nova Scotians. It's money in their pockets at the pharmacy counter, and it's money in their pockets in terms of taxpayers. We don't have to raise taxes to sustain our pharmacare program, Madam Chair, because we've been able to get a better deal and a fair price for generic drugs. So now let me talk a bit about the process we've used, because I want people to be absolutely crystal clear that this has not been a rush job. In fact, I took a little bit of heat last year in the public when Ontario went out and did their announcement on what they were doing. Why weren't we rushing ahead and doing the same thing? And you know, the reason for that is we're not Ontario, we're a small province. I mean, the drug portfolio in the province of Ontario is way bigger than our entire healthcare budget. It's unbelievable. It's in the billions. They spend billions of dollars on their drug plans, billions. And so the Minister of Health in Ontario can stand up and say, we're going to save $153 million with our drug strategy. $153 million they anticipated they would save. That's more than half. That's more than half of what we spend on drugs. And what they're saving is just a tiny little fraction of what they pay on their plans. Their plans are in the billions. So we wanted to do a number of things. We wanted to get it right. We wanted to have a process where we did lots of consultation with all of the parties who have an interest in this. And those parties are pharmacists, owners of pharmacies, generic drug manufacturers, consumers, seniors in particular, members of private plans. We have a number of very large private plans in the province. And just, you know, your garden variety Nova Scotian, any citizen who wanted to comment on fair drug prices was certainly welcome and free to do so. So we went through a process. We had a very small, very tightly focused discussion paper that outlined a number of questions, and we circulated that in a targeted way to the stakeholders. We put it on our website. We announced we were doing this consultation. We did it in a very concentrated and tightly planned period of time so that it didn't go on forever. And we met with people. We had excellent response, very good turnout, good level of participation, and we were pleased with how that all went. And then we got all of the information back, and we organized the responses, and we made the responses public. We put them up on our website. We put a release out, and we said, here is the result of the public consultations. Here's who we heard from, and here's what we heard. Here's what they told us. And we made it clear that we were moving forward with our plan to get fair generic drug prices for Nova Scotians. Last week, I announced the features of that plan, what it is we intend to do. And I introduced a bill here in the legislature which would allow, and the draft regulations we released as well. And we did that because we're moving forward with this plan. And we're very committed, very dedicated to getting fair drug prices. What do we think fair drug prices should look like? Well, they shouldn't be 60–70% of the brand drug, number one. We've also, in addition to the consultation that we've done, we have done our research, and we've looked at what are the policy positions of every other province in the country. We're looking at what are they doing in BC on this. You know, people in BC don't want to be any more fleeced by the generic drug companies than people in Nova Scotia, frankly. And they're doing pretty much what we're doing. Same thing with people in Alberta and in Manitoba and Saskatchewan. Saskatchewan launched their strategy last week, put it up, and they're doing pretty much what we're doing. They are, and what these other provinces are doing, they're capping the price of generic drugs. And they're capping the price of generic drugs at 35% of brand. They're not doing it immediately, neither are we. We intend to phase that in over a year. So we have legislation here on the floor now, and our plan is that on the 1st of July of this year, we will cap the price of generic drugs in Nova Scotia at 45% of brand. And then 6 months later, in January of 12, the cap will move to 40% of brand. And then the 1st of July in 2012, we will cap the price at 35% of brand. Now, I've been asked why we didn't go to 25%, which is what Ontario did. And, you know, here I think there are lessons to be learned by really assessing, watching what a big player like Ontario does, and give them some time to put it in place and assess it, and determine whether or not that's what you want to do. And to be frank, in Ontario, there are so many drugs that have had exceptions because some people say because the cap is at 25%, it went a little too far. And if you have a lot of exceptions made to the cap, that requires a certain amount of bureaucracy to do the assessment of the appeals, gather the information, hold the meetings, all of that kind of stuff. The savings that you think you're going to get, you eat up pretty fast in having to construct a whole bunch of bureaucracy to enforce a 25% cap. So we decided 35% seemed like a reasonable level to arrive at. We certainly will see significant savings. The consumers will see significant savings. Taxpayers will see significant savings. Hopefully it will avoid the problem of exemptions and a lot of difficulties. And at the end of the day, we will be able to, you know that we've gotten a good and fair deal on drug prices for Nova Scotians. And when I look at other provinces, the 35% cap is what they've arrived at as well. So we're in very, very good, we're in very good company. Now, there are a number of other things that we're doing with our Made in Nova Scotia plan that Ontario did not do, or that Ontario did and we decided not to do. Ontario abolished rebates, and we had, you know, there's a fair amount of discussion about rebates in the media back in the fall when Ontario did their plan, and I think the average person had no idea such a thing existed. You know, in fact, you'd have to be pretty much in the know in the industry to know that there was such a thing as rebates in the pharmacy business for the most part, right? You know? And so this came as, I think, a bit of a surprise to many people that manufacturers pay pharmacies to stock their product. And it's a common industry practice, you know, in a lot of retail type businesses. It occurs in the grocery stores, in the grocery industry, and it occurs in quite a few industries in retail. So pharmacy is no different. Ontario made it mandatory that pharmacies report for a period of a number of years. They report their rebates, and they started a process to eliminate their rebates. Rebates would be completely eliminated. Some people say, and I don't know, we'll have to wait and see, some people say that capping the prices of generic drugs will ultimately lead to an elimination of rebates, or at least a reduction in rebates. I don't know if that actually will be the case. But that's not our objective. Our objective isn't to, that's a business practice that goes on between the industry and the retailer, and that's kind of up to them to sort out. Our concern is not around their business practices and the transparency of their business practices. Our concern is fair drug prices for Nova Scotians. Our concern is that Nova Scotians shouldn't have to pay prices for generic drugs that are unreasonable. They should get a fair price for a generic drug. If it's a generic drug, we expect to have a fair price. And